Good morning, I'm Stacie Grossfeld. I'm an orthopedic surgeon from Louisville, Kentucky. I'm going to talk this morning about tennis elbow and tennis. Actually, most people that have tennis elbow don't even play tennis. But for you that play tennis and get tennis elbow, there's some things you can do to modify your racket that will help you either one, get over your tennis elbow, or two, prevent it from coming back. So the first thing is, when you look at your tennis racket, the string on the racket, you would want a blended type string. You don't want a monofilament type string. So go to your friendly racket stringer who's probably at your club and tell them you want a blended type string. So you can tell the blended string because it'll have at least two kind of different colors in the string, where the monofilament tends to be one dark uniform color. The monofilament just isn't as forgiving as a blended string. You'll also want to go down on your string gauge size. So the smaller the string, the more forgiving it is. For example, this is a 17 gauge string. So you'd want to use 17 gauge or smaller, which is actually a little confusing because the smaller the size, actually the higher the number. So if you have a 15 gauge string, you definitely want to go down to a 16 or a 17 would be my recommendation. The next thing is, with your grip, you want to overwrap your grip at least one layer. The smaller your grip, the more you tend to squeeze the racket, and that can put a lot of stress on your lateral epicondylar area. So you can either overwrap your grip or get your pro just to overwrap the grip for you, and that can help reduce the tennis elbow. The next thing is the actual racket itself. So you want a racket that has more flexibility. You don't want a stiff racket. So you will see some players who have these massive heads on their rackets and they're super stiff, and it gives them a ton of power when they're at the net. But that power, that stiffness, when you hit the ball, so when you hit that ball, it goes to the strings, up the neck of the racket, and then into your elbow. So you want a more flexible racket. Now, a more flexible racket will not give you as much power or pace, so you're going to have to generate that yourself, through your core and your shoulder and your legs. But the stiff rackets are really elbow eaters, is what I like to call them. So talk to your pro, talk to your tennis shop. You want a racket that is more flexible, so that that force is not being transmitted up into your elbow when you go to hit the ball. The next thing is the size of the racket head. So the smaller the head, the better. So if you can get away from one of these huge, big, oversized heads that you see a lot of doubles players use, and go to a more of a player racket size head, which is about 110 square inches versus like the 140s, and I think there's even like 150 size head racket. So you want to go with a smaller racket head. And then the final thing is the tension of your string. So if you're stringing your racket at 58 or 60 pounds or even 62 pounds, go down a couple pounds. So when you have your pro restring your racket, tell them you've got tennis elbow, whatever it was strung at last time, you need to go down at least 2 pounds. And those are some things you can do to modify your racket, which will help you get back on the court quicker and prevent recurrence, and also help that elbow to heal. Thank you.